Thank you, Mr. Speaker, and through you to the members. I rise in support of this consolidated amendment, and I want to begin by thanking the Chairman of Ways and Means, the gentleman from Boston, and the Speaker of the House. Members can be proud of the priorities we have articulated in this budget, and in particular in this amendment. It has often been said that our budget is more than a recitation of statistics and figures. It is a statement of our priorities. This is more true now than on most occasions when we meet in this august chamber. In this amendment, this body has chosen to fund domestic violence and sexual assault services $1 million above the original figures released by the Committee on Ways and Means of the House. This amendment will fund domestic violence and sexual assault prevention programs, treatment programs including rape prevention and victim services, sexual assault and domestic violence prevention programs will be funded, domestic violence batterers programs, intervention services, community engagement and intervention services, and crisis housing for victims of sexual assault. Over 40 members joined in the effort to support additional funding for these services in critical areas of domestic violence and sexual assault because they know that there is a direct correlation between a down economy and an uptick in crimes of this nature. According to a 2004 study by the National Institute of Justice, women whose male partners experienced 2 or more periods of unemployment over the 5-year course of the study were 3 times more likely to be abused. Given the current economic downturn, a cut in funding would be devastating to a system already experiencing a spike in cases. Since January of this year, 11 people have already been murdered in domestic violence incidents in Massachusetts. And sadly, last night in my hometown of Braintree, there was a domestic violence murder in the town of Braintree. A woman was killed by her boyfriend, and it's only the latest of what we're seeing as a disturbing trend. The link between financial problems and an increase in domestic violence cannot be ignored. The National Domestic Violence Hotline noticed a spike of hotline calls in September 2008, up 21% over the previous year for that month. In October 2008 alone, the calls were up by 18% compared with 2007 numbers. This coincides directly with the market crash that we saw last fall. We all know that we must remain resolute in our fight against domestic violence. The facts are alarming. 1 in 6 women and 1 in 33 men have experienced an attempted or completed rape. More than half of those rapes for women will occur before they reach the age of 18. 1 in 4 women will experience domestic violence during her lifetime. Further, men who are exposed to physical, sexual, or domestic violence as children are 4 times more likely to perpetrate domestic violence as adults. In the past 5 years alone, there have been 173 known domestic violence homicides in the state of Massachusetts. It is for these reasons that we must fund these essential services to try to address these pernicious facts. Many programs who address these problems report a critical shortage of funds and staff to assist victims in need of services. Services such as transportation, child care, language translation, mental health, and substance abuse counseling. Programs reported that lack of staffing was a reason that they could not meet domestic violence and victims' requests for services. On one day in September of 2008, hotlines received 1,017 calls alone for help and assistance in cases of domestic violence. Indeed, the recently released research on violence against women reveals that Massachusetts is currently under-resourced in a variety of critical areas per capita. These include family shelters, rape crisis centers, sexual assault advocates, advocacy programs, and counseling programs. Members in this chamber know this. That is why they have rallied to the aid of these programs and to these professionals who work on behalf of victims of crimes. As a former prosecutor in Norfolk County assigned to the Domestic Violence and Sexual Assault Unit, I had an opportunity to work alongside these professionals. They are dedicated, compassionate, and effective. I came to admire their efforts as I admired the courage of victims who stood up to their assailants. In addition to the members in this chamber who advocated for this funding, I also want to thank Jane Doe, Inc. as an organization for its leadership on this policy and for its work on behalf of victims. I want to thank the 40 members who lent their names, their energy, and their effort to this endeavor. And I thank the Chairman of Ways and Means, the Speaker, for prioritizing this area of discipline, I also want to thank the chairman of the Public Health Committee, the gentleman of Boston, for his work in the area of public health. In closing, I encourage all of my fellow members to join me in supporting this consolidated amendment. Thank you.